tingling, numbness and burning sensation in your wrists? You've found the right place. Alright guys, it's Nathan here from Cryotherapy UK Sheffield, and in today's video we're going to be talking all about carpal tunnel syndrome. So carpal tunnel syndrome is a horrible injury which affects the hands and wrists and really stops people from doing simple things that we take for granted, such as holding a cup of tea or holding something heavy in the hand, due to the pain and tingling sensation that they get in the wrist. So in today's video we're going to be looking at what carpal tunnel is and how it may be caused, and what the signs and symptoms are, and how you can identify whether you are suffering with carpal tunnel syndrome. So first of all, we need to understand what carpal tunnel syndrome is. So the carpal tunnel is formed by the bony prominence of the carpal bones and the flexor retinaculum, and it sits just in your wrist around about here. So in the carpal tunnel we have a lot of tendons, so the flexor tendons run through the carpal tunnel, and also the median nerve. So the median nerve starts in the shoulder and it runs all the way down the arm, through the carpal tunnel in here, into the thumb and the first and second fingers. So restriction of the carpal tunnel will impinge the median nerve, which will cause a tingling, numbness and burning sensation in the hands and wrists. So this impingement can occur in one of two ways, which is Neuropraxia and Neuromesis. And I'm going to explain the difference between the two. So we're going to start off with Neuropraxia. Neuropraxia is bruising and compression of the nerve and is usually reversible with treatment. So when the surrounding connective tissues become injured or inflamed, that starts to cause restriction and compression within the carpal tunnel, which then puts pressure on the median nerve. So signs and symptoms of Neuropraxia will be a burning sensation or pins and needles, numbness or weakness or paralysis in the affected area, and atrophy of the affected muscles. Possible causes would be an impact injury, compression or impingement of the median nerve, or ischemia, which is the restriction of blood flow to the area. So as said previously, this is typically reversible with the correct treatment. So make sure if you are suffering with any of these signs and symptoms and you think you are suffering with carpal tunnel, you'll get it checked out by a therapist or a specialist. So next on our list is neuromesis. So neuromesis is a severe nerve injury and usually is permanent. So neuromesis is partial or complete severance of the nerve, which disrupts nerve function. So this type of damage is usually permanent and special treatment will be required to correct this, such as surgery. So if it's neuromesis you'll have the burning and tingling sensation and the pins and needles, weakness, numbness and paralysis. However, all these symptoms will be on a much more significant level than if you had neuropraxia. Also, there is typically an underlying issue which is causing this, so it is very important that you see a specialist to make sure you get this all checked out. Okay guys, so that concludes today's video on carpal tunnel syndrome. If you liked the video and found it useful, make sure you give us a thumbs up. Make sure you're following us on all social media platforms. As always, appreciate you guys. Thanks for watching and we'll see you in the next one. Peace.
You never know what's around the next corner.